Body composition determined from skin fold thickness measurements correlates well with body composition determined by hydrodensitometry. The principle behind skin fold measurements is that the amount of subcutaneous fat is proportional to the total amount of body fat. It is assumed that close to 1/3 of the total fat is located subcutaneously. All measurements should be made on the right side of the body with the subject standing upright. The caliper should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. The pinch should be maintained while reading the caliper. Wait 1 to 2 seconds, not longer, before reading the caliper. Make sure to take duplicate measurements at each site and retest if duplicate measurements are not within 1 to 2 millimeters of each other. Rotate throughout measurement sites or allow time for skin to regain normal texture and thickness. Each measurement site should be marked before being measured. The triceps measurement is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon process, with the arm held freely to the side of the body. Subscapular skin fold is a diagonal fold at a 45-degree angle 1 to 2 centimeters below the inferior angle of the scapula. If you have a difficulty finding it, make sure to lift the upper arm and you will be able to find the skin fold. The mid-axillary skin fold is a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. The best way to find the mid-axillary fold is to have the patient move their arm back. The abdominal skin fold is a vertical fold 2 centimeters to the right of the umbilicus. The chest and/or pectoral skin fold is a diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. Suprailiac skin fold is a diagonal fold in line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. Make sure to ask the patient to point to where their iliac crest is. Thigh skin fold is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease or the hip. If the patient is wearing shorts, ask him or her to raise their shorts in order to find the skin fold. This is an example of a table where you can record your measurements and take the mean of the 3 trials in order to find the sum used in the body density equations. These are the bone density formulas for male and female. The 7-site formula includes the chest, mid-axillary, triceps, subscapular, abdomen, suprailiac, and thigh skin fold measurements. Once body density is calculated, you can use the Brozek and Siri equations in order to find the body fat percentage.